Hello and welcome. You're watching FYI. I'm Sonal Mehrotra Kapoor. Now finally, after days of bad news on COVID, some good news coming your way. So we at FYI were quick to grab that and let's put that out for you. Well, India finally has what it needs the most right now. More vaccines. What am I talking about? Well, here's an explainer to take you through the details. So India is gearing up for a new vaccine, the Russian-made Sputnik V, which means that India soon will have not 2, but 3 vaccines, which at a time when the country desperately needs more and more is definitely good news for all. So let's take a look at how Sputnik V is different from the other 2 vaccines presently available in the country. Is it better, and importantly, does it work against the new double mutation? Let's begin by looking at the technology. Sputnik V is an adenoviral-based vaccine. It uses a weakened virus and stimulates an immune response. This is similar to what Oxford AstraZeneca jab Covishield does as well, which uses the virus that causes chimpanzees to get the common cold. While the Bharat Biotech Covaxin is different. It is an inactivated vaccine, meaning it is a chemically killed virus which once infected and injected in your body will then mimic the strain and develop an antibody against COVID-19. Let's look at how the doses are now. While all 3 are 2-dose vaccines, Sputnik, unlike the others, actually uses 2 different versions of formulas for both its jabs, given 21 days apart. The idea is that using 2 different formulas boosts the immune system even more, unlike the same being used twice, which is the case for, say, Covishield and Covaxin. Sputnik claims that this gives longer lasting protection, and the 2 different formulas is not just proved effective, it is also something that makes it safe with no serious reactions. It is also what gives Sputnik V around 92% efficacy. And it has also been deemed to be safe and offer complete protection against hospitalization and death. Now, this is where Sputnik really scores against the other 2 vaccines. While AstraZeneca and Covishield have the efficacy of roughly about 70%, Bharat Biotech Covaxin, though not peer-reviewed, claims to have 80%. Storage, not an issue with all 3 vaccines, as all 3 can be stored at refrigerator levels, making it conducive for India. However, Sputnik V scores in this as well, as it is freeze-dried vaccine, meaning it comes in a powder form. It improves the stability along with the storage and shelf life of the vaccine. Now, let's talk about the most pressing bits. Does it work against the new variants? Now, while all vaccines claim to work against the strain, but don't really have any data or study backing these claims, Sputnik V, by its own admission, says that it is less effective against the South African variant, but compared to all the vaccines in the world, it is the best at neutralizing the UK strain. Now, Covishield claims it reduces the rate of hospitalization in the UK strain. But remember, South Africa had sent back 1 million AstraZeneca jabs to India, saying it does not work against their strain. While in the case of Covaxin, the ICMR gave a statement saying that it works against the UK variant. So with all this, it really comes down to how soon can we have the vaccine in India and what about its manufacturing capabilities. Now, good news here is that Sputnik has already partnered with several Indian manufacturers, and it is going to produce and supply a minimum of 200 million doses. But the not so good news here is that, at least so far, they say they will be ready by only the 4th quarter of this year. In fact, I spoke about this to the CEO of the Russian Direct Investment Fund, which is Colonel Dmitriev, and he's the head of the Russian Direct Investment Fund that has financed for the development of Sputnik V. And I tried to understand from him about what exactly was the initial hiccup when it came to Sputnik V and how is the world bracing it now. He spoke to me from Moscow. One of the first vaccines to get registered against coronavirus, right? The efficacy of Sputnik V, like you said, with the data published at Lancet, one of the world's most oldest and most respected medical journals. In fact, important to highlight that Sputnik is one of the 3 vaccines in the world with efficacy over 90%. Then, why do you think that there was this initial skepticism over the vaccine, say, over the Western formulas?
Well, I think, first of all, the skepticism is gone because some people just tried not to make Sputnik successful, but following results of the Lancet and successful vaccination, there is no more skepticism. I think the only questions that people are asking is about production of Sputnik, and here we have great partners.
But why do you think it existed in the first place?
Well, frankly, there are big pharma companies who are not very happy about some of the competitors that are coming to the world, but we believe that all of the different producers should work together, as we have a partnership with AstraZeneca. So we believe some players wanted to contain Russia, wanted to limit Sputnik V from accessing the world, but we just want to be one of the players. In none of the countries we can serve more than 25% of the population. So we are just part of the total portfolio solution. And frankly, all of the skepticism is gone. You see very positive reaction even from Europe and Germany, and Chancellor Merkel has been very positive.
Sure.
Places that have traditionally been skeptical a bit about, cooperation with Russia. We believe that Sputnik V works very well against different mutations. We proved that it's as efficient against British strain as against the previous original coronavirus.
So that was a little interaction we had earlier on with the CEO and trying to tell us what exactly the skepticism was all about. But let's take this comparison really that we've drawn for you between the three vaccines soon to be now available in India with our guests. We've got Dr. Shamsher Dwivedi, head of the COVID task force at Wimhans, joining us. Thank you so much for your time, sir. We also have with us Professor and Dr. Anita Ramesh. She is specialist in clinical trials and the new drug launch as principal investigator in more than 20 of those trials in India. So our real understanding from both of you today will be to try and ascertain really where does the solution lie, and it clearly lies with more vaccines, but what should India really be focusing on now? Let me first begin by bringing in Dr. Shamsher here. Dr. Shamsher, when you look at vaccines in general, and now there are several available across the board, across the world really, what are the basic parameters for you that hold importance? Something that should be the first thing that you lay attention to when you look at a vaccine and a product like that?
So there are primarily two parameters, efficacy and safety.
Okay.
As far as drug regulators are concerned, they are more worried about the safety than the efficacy. Safety comes first. But this is a very peculiar and unique situation which we are facing at this point of time. I think the standard rule of safety first has not taken a backseat but has been a little diluted because the safety data are not robust. I would say there are safety data, but they are not so robust, and while the vaccination is going on, we are getting data which is making it more robust as the vaccination drive goes on. So I would say that at this point of time the standard rules of the game won't apply. So efficacy definitely will take a precedence over, because most of them are more or less safe with minor aberrations. So I would say efficacy becomes a very important issue at this point of time.
All right, lots to read between the lines over there on what you've just said. Let me bring in Anita Ramesh there. Dr. Ramesh, at this point, when you've seen, like we're bringing out all the different efficacies, the different technologies, all the three vaccine uses, from an India perspective, what is required right now in terms of combinations of what these vaccines bring to us?
Yes, only two of them are previously approved by the phase 3 data being published. One is the Covishield and Covaxin. Recently, as my understanding goes, that's 12th April, as on today, the Russian vaccine has been granted for emergency use in India by the DCGI.
We understand that the drug regulator has to still give its approval, and then they will get into manufacturing phase. All that we understand. But just looking at the vaccine on paper as is, what would you say is the best for India?
Yes, see, I think all the three are at par because as you rightly said, the temperature maintenance is 2 to 8 and it is quite easily can be done in India, starting from Kashmir to Kanyakumari, and the summer season is coming. This is the best vaccine. We cannot have Pfizer and Moderna in India because that cold chain cannot be maintained. Secondly, the cost has to be low because it has to be manufactured in India, and as much as I know, the Sputnik Russian has collaborated with Dr. Reddy's in India, and also also Panacea Biotech in India. These are two Indian companies which are now going to produce the Sputnik. Definitely it has to be cheaper, bulk production has to be there, like how Serum Institute is making the Covishield and Covaxin.
Okay.
So bulk production is needed, availability is needed, it has to be nicely distributed, maintaining the cold chain in all parts of India. Third point, efficacy. Yes, I understand what the data says. This Sputnik has the highest efficacy, whereas Covishield is 70. But if you alter the dosage of Covishield, the efficacy increases up to 80, and Covaxin is 80%. So as of now, this is one of the highest. It's very good news for India, and we need more vaccines with a high efficacy rate.
In fact, Johnson & Johnson is something that you missed there, but I did ask the CEO there of Sputnik V, trying to understand how that fared, and he believes that Johnson & Johnson is actually just the first dose of Sputnik V. That's what he believes, and he says that, and they're already now working with AstraZeneca as well to try and improve that efficacy. So that's something we wait to hear from. But Dr. Dwivedi, let me come back to you. Now, there are two things that really are on everybody's mind right now, keeping the second wave in mind, right? One, will it work against this double mutation that is there in the country? And second, what about reinfections? What are, in your opinion, amongst the three, how do they fare when it comes to both these issues?
So coming to the first issue first, I think as far as efficacy against the newer strains is concerned, let me tell you, although the data is still very weak, but I would, in the long run, what we would see is that most of them have focused on the spike protein, as Covaxin is the whole virus, which is the dead inactivated virus.
Right.
Most of them, they have focused on the spike protein. Unless and until there is a mutation, major mutation in the spike protein,
Okay.
most of them will have some effect as far as the severity of the disease is concerned. It may not
give an example for that, just for our viewers. When you say the two other vaccines like Covishield and Sputnik, for example, they use a form in which, if I were to make it simpler for viewers to understand, they use like a Trojan horse. It's actually put in, the antibodies are inside, say, sometimes a virus which was used in chimpanzees for a common cold, sometimes a dead virus in India, etc. So it's like a Trojan horse used. You are saying inside that Trojan horse, which is used to pump in the spike protein, there is a change. That's what you're saying.
So if, see, most of the antibodies that are being made, most of the vaccines that are being made, they have worked towards creating antibodies against the spike protein.
Right.
That is what I'm trying to say. Now, even if there is a variant which is different from the strain from which the vaccine was produced, if there hasn't been any major mutation in the spike protein, because there is rest of the body of the virus also. If there is a mutation in rest of the body, it will become a challenge for the vaccine to deal with it. But if there isn't a major change in the protein sequencing of the spike protein, if the spike protein doesn't show any mutation, then even if the person gets infected, the severity of the infection, the killer potential of the virus would be reduced. So we are seeing, even in our hospital, my colleagues, few of them got infected. They were fully vaccinated. And still they got infected, but in most of the cases, it is a mild infection.
That's right.
It's not a very severe infection.
In fact, I'm very happy that you brought that up, because one of the most frequently asked questions from viewers who sent us their questions as well is this, on how is it and should I even go for a vaccine when I'm going to get COVID anyway. So just to all of them, if Dr. Anita could also just specify it for our viewers, that any vaccine except the nasal one, of what I know at least so far, none of the vaccines actually give you protection. They give you the immunity to fight out the virus, and then when you do get it, you are at a better position to fight it, and then it's a milder disease that you fight. Dr. Anita, please correct me if I'm wrong.
Yes, you are right. The definition of efficacy means that if I inject this vaccine to 100 people, 90% for Sputnik, 80% for Covaxin, 70% for Covishield patient will not get the virus infection, but 10 to 30% will definitely get the infection. But yes, your body immunity is built up by the vaccine. The infection can come, but the antibodies inside your body is going to fight out the infection. It's going to be a milder infection. You may not need hospital admission. You may not need ventilator. You may not need the higher drugs like remdesivir, teclizumab. It is mild and just quarantine 14 days, 3 weeks, are out of it. So vaccine gives you that protection of no infection and a milder infection. So all the viewers, please do not hesitate. This is what is available with you now. Just obey the rules and regulation as per the guidelines about the age of 40.
That's right. I'm very happy you said that, and that's been our request.
Without seeing what vaccine is there.
That's been NDTV's campaign as well. We're asking everybody to get themselves vaccinated. In fact, as in when your turn comes, I've personally been urging for vaccines to be opened up for all, the sooner the better.
Yes.
But Dr. Dwivedi, let me come back to you. And before I slip into a break there, at the moment, currently the second strain is behaving very differently. We are hearing from doctors in how in many of them the lung function that used to see being a little hampered in later stages, that's coming a little previously now, much earlier in days of infection. We're also looking at some other forms like nausea, etc., clotting, etc., that is being seen as well. Keeping those things in mind, would you say that currently what is the need of the hour? More vaccines, but also vaccines that work against the variant? Dr. Dwivedi?
Yeah, I think at this point of time, as science would understand more about the virus, I feel that in due course of time, we would have polyvalent vaccines, where the vaccine will have more than one strain, like the way every year we take flu shots. Every year
H1N1.
New strain of flu shots, and then you get a new vaccine. So we would get a COVID vaccine every year, a new addition as per the prevalent strain. This virus has shown, like influenza virus, this virus has shown that it rapidly mutates.
Right.
And unless and until you don't keep chasing the mutants, the one vaccine which you are developing this year may not be effective forever. You might have to keep making new vaccines every year, the way flu shots are being renewed every year.
All right, on that note, so the takeaway from here is don't wait for a better vaccine to come your way. You have to take what is available right now, because that's your only way of cutting down the chain of transmission and fighting out and getting out of this pandemic. On that note, let's slip into a break. On the other side, we've got some viewer questions and we'll take that to our experts. Welcome back. Now, this is a segment which will be a regular feature now throughout the week and hopefully later if you guys want, which is basically when all the questions that you people send us, FYI, we'll have them answered from the experts every day towards the end of the program. So let's take the first question now. And Dr. Dwivedi, if you could answer that one. It says, do I need to be vaccinated if I have already recovered from COVID? And actually, my director has an addition to that. The follow-up is, if you already have antibodies, if you've recovered from COVID, how many days do you need to wait to get your vaccine?
Now, the precise scientific answer to this question is I don't know. But at this point of time, the recommendation and the guideline says that yes, you still have to get vaccinated. Suppose if you are already vaccinated, if you are already having antibodies, at the most, what will the vaccine do? The vaccine will further jack up your antibodies level. You are better protected. It is not going to harm you in any way. So the answer to this question is yes, you should get vaccinated. There are many patients who get infected but they don't produce antibodies. So instead of creating that confusion, the standard guideline says that yes, you have to get vaccinated whether you have antibodies or you don't have antibodies.
But there's no reaction in case you have antibodies and then you get the vaccine as well.
So if you have antibodies and if you take vaccine, there can be maybe slightly more severe reactions, which would include fever, nausea, headache, etc., which can be more severe. But then we have that paracetamol, which is easily available, that will take care of most of the patients, and usually after vaccination this acute reaction doesn't last for more than 48 hours. So I don't think that should be a major concern.
I was reading that you have to wait for a period of at least 3 weeks after you recover from COVID to get yourself vaccinated?
Yes, if you have already suffered from COVID, then yes, you have to wait you have to give a cooling off period for the vaccine to be given, because all your parameters, which include blood parameters, include ferritin level, ESR level, CRP level, these are already very high. The inflammation in the body is already very high.
Right.
So adding something which will further enhance inflammation, that is not good for the body. So that is the reason why you should allow the body to cool down, the inflammation to subside, and then go for the vaccine.
That actually makes a lot of sense. Thanks for clarifying that. Let me take the next question to Dr. Neeta, where another viewer wrote to us saying, I got COVID after my first dose. So do I still need the second dose?
Yes, once you get the COVID, you do have antibodies developed in your body, but I think that you should also complete the second dose. Whether the COVID infection causes enough antibody, it rather helps you. You will get more amount of the antibody in your body, but please complete the recommended vaccination as per schedule of the vaccine that you have taken, irrespective whether you are getting the COVID in between or not.
Okay, but remember that window that Dr. Reddy spoke about in mind. So those were the two questions for the day. You can keep writing to us on all our social media platforms. Just remember to hashtag FYI, and we'll take up with our experts as well. Thank you both for giving us your important time in such trying times, really, and sort of, cutting the clutter and giving our some valuable solution really to people. That's it from on today's episode. For tomorrow, let me give our viewers a quick teaser over there. Tomorrow we'll be doing something very interesting. We'll compare the first strain of COVID-19 in India to what it has now become. Is it acting differently? What are the reactions like? What are the doctors witnessing, and what you need to do? So join us again 7:30 tomorrow. Good night for now.